Welcome. My name is Shauna Wilburn and I'm one of the trainers here at eMedApps. Today I'd like to review with you how to set up your system so that your care guidelines can update based on images scanned into the patient's chart. This is a new feature in the NextGen 6.2021 upgrade, and I couldn't be more excited to share with you some of the details about how to set this up and configure it within your NextGen application. So we have Danny Ocean's chart open here, and I'm going to go into care guidelines and take a quick peek at what might be due on the chart. And we can see here that Danny Ocean is due for his colonoscopy. If we look in the categories tab of the history toolbar, we're going to see that colonoscopy was actually done on date of service 1/3. We know that service was completed for Mr. Ocean because we have the results already scanned into our chart. So what we ultimately need to do is link this scanned image to the care guideline item so that not only for Danny Ocean, but any patient in our system, in our NextGen system, anytime a document is scanned into that particular document type, the system will see that and automatically update the care guideline for you. There's no data required to be entered into NextGen, and there's no manual intervention other than your normal protocol of scanning those test results into the patient's charts. So in order to complete this configuration, we're going to go up to File, System Practice Template. And on the System tab, I'm going to click All and go to Configuration Home. I like Configuration Home because it has a lot of options here on the left, and I'm just going to choose my care guidelines setup. If you choose to get to this template a different way, that is perfectly fine. There is no right or wrong. So in order to set up your care guidelines to update based on document types and scanned images, the one step that you have to do kind of up front is checkmark Enable Document Types to satisfy care guidelines. When you first come into this template, your document types panel could potentially be grayed out, and that's because this checkbox is not checked. Checkmark this box here at the top. It'll populate this panel so that you can now document information in this section of the template. So the first thing we're going to populate is labeled test name. This is your care guideline. So we're going to choose colonoscopy. And then the second field is the document type. So this is the document type that when it's scanned into the patient's chart, you want it to satisfy that care guideline. And in this case, we've also named it colonoscopy. Now, in my example, these two items exactly match, but that doesn't have to be the case at all. And I'm going to click Add Update and move this colonoscopy here to the bottom section of this grid. Anything that is present in the bottom section of the grid for the test name listed will auto-satisfy that item when documents are scanned into that document type. So if I were to have 3 or 4 different document types here, anything that's scanned into those document types would satisfy that particular care guideline. Now in this case, we're good. We only need the one, so we're just going to stick with what we have configured here, and we're all set. But just one quick note on the configuration I did want to mention is when you come in here and you choose document type, you don't see all of your document types, or most likely you will not see them all. So if you go to scan an item in document management and you go to file that item, you might have 50, 60 items listed in your document types list. But when you come in here to configure care guidelines, you might have 20 or 30. That's because care guidelines requires date of service to be one of the fields on your document type configuration. So it's only presenting to you items that are configured in file maintenance with the document types that are configured in file maintenance with a date of service configured as one of the elements to populate when filing. So if you notice anything's missing here, there's 2 things to check in file maintenance. One, check and make sure you have date of service. And if you still don't see it, check your security and make sure your security group has access to it. It's probably one of the 2 items, and then it would, log out, log back in after you make that change, and you'd probably populate for you. But getting back to the care guidelines, we've got this one configured here. So now what I can do is just save and close my configuration. And because I had this template open when I was making those changes, I need to do a quick refresh. So I'm just going to hop into another template. I could have closed and reopened that template. Either way would have refreshed it. And now I'm going to go back into care guidelines, and you're going to see my colonoscopy is no longer present here on this first page, because this first page is all of the items in red that are due. And because I linked that scanned document to the colonoscopy, it's no longer due. So I'm just going to pop to my last page and maybe go back a couple pages and just find that colonoscopy again. just to illustrate that the system did work and everything is now connected for us. And there's my colonoscopy, and it shows completed on 1/3, which is the date of service I entered when I was scanning and filing that document or that test result into document management. So that's the date of service date when you're filing that, scanning and filing that in, will be used by Care Guidelines to automatically satisfy that particular item that you had it linked to. I'm a complete Care Guidelines geek. I love the Care Guidelines. I would love to talk to you more, but I needed to keep this session short today. But if you have any other questions or anything that we could answer for you, please do not hesitate to reach out. We would love to talk with you more about your Care Guidelines and how we might be able to make those a really useful tool for your clinical team.